First guest is Miss Stephanie Clark, who is a nurse practitioner with Baptist Health Heart and Valve Center. Did I get all that right?
Jesselyn Clark.
Jesselyn Clark. Okay, Stephanie Turner.
Yes.
Right, got that right. And you're an RN, and you're the manager of the Heart and Valve Center.
Yes.
So all right, now I think I got you straight. So, so heart disease is a big deal. It's a big deal for the hospital, but it's just a big deal. Period.
1 in 3 Americans can suffer from some form of heart disease, whether it be from severe chest pain, heart attack, heart failure, or cardiac arrhythmias. And so we want to try to prevent the heart disease, but when the heart disease is identified, then we want to have easy and early treatment.
When you talk about heart disease, and everybody thinks about heart attack, but you can have heart disease that's not necessarily a heart attack.
Correct. So that's what we wanted to come today and talk about our Heart and Valve Center at Baptist Health Lexington, and specifically talk about 4 clinics that we have within that center. So we have a low-risk chest pain clinic, which is not for acute chest pain, because like if you think you're having a heart attack, you need to go to the emergency room, but it would be for somebody who's having chronic chest pain, who's had it over a period of time. Primary care maybe hasn't been able, wants to rule out that it is heart. They could come to our low-risk chest pain clinic for a full cardiac workup.
That would help them determine if it is heart disease or what might be the next steps.
Correct. And then we have an Afib arrhythmia clinic, and our Afib program, we were the first accredited Afib program in the United States at Baptist Lexington. And we see new onset Afib patients, or if you've had a history of Afib for years and it's reoccurring, you can come to our clinic. And what's really special about the Heart and Valve Center is we were created for accessibility. So we see patients same day or next day for their appointments.
Okay, now Jesselyn, you mentioned Afib. Tell us what that is.
Well, atrial fibrillation is an electrical problem of the heart where the heart will beat irregular, sometimes fast. When we think about heart attacks, you think more of plumbing problems, blockages in the heart. Some patients will have symptoms with atrial fibrillation. They may feel their heart pounding, racing, a fluttering sensation in their chest. Some may feel dizzy, lightheaded, may feel short of breath, or maybe even have chest discomfort. When you're treating atrial fibrillation, what's so important, one, you want to manage their symptoms, but atrial fibrillation can increase risk of stroke. So you want to identify that, you want to treat it appropriately, and also you want to prevent other problems like heart failure associated with atrial fibrillation that's not treated.
Ms. Stephanie, she missed heart failure, and that's part of one of your clinics also.
It is. We have an advanced heart failure clinic. Our goal with our heart failure patients is really to try to decrease hospitalizations with those patients, and that's with medication management. And we can do IV medications in our clinic with those patients to keep them out of the hospital.
Now, high blood pressure is a thing that leads to heart disease, but you also have a clinic that deals with that.
Yes. So for patients who have been treated by their primary care provider and you're maybe having difficulty getting their blood pressure under control, that's another step we may take for further evaluation. Maybe look at, is renal disease a problem? Are we just not on maximum therapy, the right therapy, or do we need to look for other causes? We find that hypertension goes untreated. Many times patients say, I feel good, so I don't need treatment. But the problem is once they feel poorly, it's already causing problems. They've already having changes in their heart or other conditions associated with it.
Also deal with some valve problems. Valves of the heart. What do you do in the valve clinic?
So we have a TAVR and MitraClip program that patients can be referred to be evaluated to have that procedure.
You mentioned TAVR. Tell us real briefly what that is.
I'll let
The transaortic valvular replacement. So for a patient who may be at higher risk for open heart surgery, this may be an option. So they actually will go in through the groins and put a valve inside of their normal valve.
Okay. So if somebody needs to access the clinic, does the patient call, does the doctor call? How do they access their clinic?
So we actually accept self-referral, so a patient can call themselves and set an appointment up next day or same day in our clinic. We also will accept from a cardiologist, primary care physician can send a referral or call our clinic and arrange an appointment.
That's great information, great care you all give. Thanks for coming in.
Thank you.